So our project was called the Feedback State, Listening and Responding to Bangladeshi Citizens During the Covid-19 Pandemic. And the aim of our project really was to figure out what kinds of mechanisms the government had in place or put in place during the pandemic to actually find out what the people of Bangladesh needed, what they were experiencing, any problems they were having getting any health or other social protection services during the pandemic. So we knew that the government had already put in place a number of mechanisms, a number of initiatives since 2009, going back that far, a number of initiatives to listen much more effectively to what citizens were saying. You know, they had a number of laws passed at the local government level to make sure that there were more systematic ways of local government officials and representatives to engage with citizens, in theory. In practice, you know, they're more unevenly implemented, but the intention is definitely there. But we did find that during the pandemic, the government was, you know, everyone was locked down, as we remember. Right? Government really pivoted quite fast to online ways of working, but also online ways and hotline ways of engaging with citizens. And the use of certain of these mechanisms, like the 333 hotline, really increased a lot. Increased a lot from a relatively low base, but increased a lot. But nevertheless, it's still not very high, given we're 170 million people. Still, you know, the health system has a really quite effective, well-designed grievance redress mechanism. You can go in person, you can go online, you can phone up and register your complaints about a particular health service, a particular health center. But still, it's not reaching a lot of people. A lot of people don't know how to use it, and frankly, it's not suited to their needs. So while the intention is there, and to some extent the mechanisms are there, there's still a bit of a gap between what is being provided in terms of mechanisms for citizen feedback and the extent to which people can actually use those. It's interesting though, in our survey we found that people were really positive nevertheless about these systems. They said it's great, the government has these grievance redress mechanisms, these complaint systems, obhijog baksho, oigulo, but they find that people don't actually use them, and what they prefer to do is they'll go in person to somebody, the Union Parishad chairman, member, somebody that they know, somebody that they can explain face to face what their problems are. So I think government has learned a lot. Our recommendations included really reflect on, you know, the proliferation of different kinds of platforms and mechanisms that you have for listening to citizens, and maybe consider streamlining them so that people know, I have this problem, I couldn't get my pension, or that health center was closed, what should I do? I should phone up 333, or I should go online, or I should go and see someone and tell them that this is my problem and that they will hopefully fix it. But one thing I think is still a bit of a gap is that a lot of people in government, a lot of people also in the NGOs and the academic world are very attracted by data, very attracted by digital platforms. And actually most people are still not there and have very good reasons for resisting them and wanting to have a face-to-face way of engaging with their government, with their state. So we were really arguing that government really needs to build out that interface. And one way of doing that, of course, is to support local organizations, local community groups, local civil society to help people to engage with the state at that level.